Obsessive-compulsive disorder is a very specific disorder that is common to people who have sometimes depression, but also anxiety. And if you have it, you probably know you do. And I think the scary thing for people who have it is they're afraid they have to live with it forever, and you don't. And examples would be contamination issues. That's a really big one for a lot of people, where they don't like to touch things because they feel like it's going to be contaminated, or they have, issues with feeling things, or the way things smell, or they're afraid their food's going to be poisoned, so they have a difficult time eating. I actually went through that one, and these are more compulsive tendencies, or maybe you're someone that needs to count things all the time, or go back and make sure you turn the stove off. Obsessive thinking is very, very common to many, many people with anxiety and depression, and that's where you get a thought in your head and you think it over and over and over, and it is torturous to be an obsessive thinker. I know, I was one. And even now, when I'm going through a difficult time in my life about something, it's hard for me not to get into a little bit of an obsessive mode. But again, there's help for this. You don't have to live like this. Medications can be so helpful in treating certain types of antidepressants specifically. So ask your doctor. Can be so helpful. You do not have to struggle with obsessive-compulsive disorder. And if you're someone who's really struggling, where you don't want to leave your home, or you don't want to put on a jacket, or you need to have a pair of gloves to open a door, or you're washing your hands constantly, or you think foods are contaminated, you're not weird, you're not crazy, you just have OCD. And there's help for this. And one of the best methods of treatment for obsessive-compulsive disorder is cognitive behavioral restructuring. And that goes back to the skills that I teach. And I've worked with thousands of people with obsessive-compulsive disorder who've gotten better, including me. So if you're someone who's constantly obsessing about your health, or about money, or about contamination, or about medications, or about death and dying, or about going crazy, please visit my website. I have some wonderful techniques there that I promise will help you. Until then, go live your life.
For more free videos and resources, please visit Lucinda Bassett at lucindabassettcoaching.com. Thank you.